teach him all of that. Teach him also that he will probably, and not probably, he will have a hemovac. Now, hemovac works just like a Jackson Pratt. Now, remember with a Jackson Pratt or a hemovac, it works how? It has to be deflated. It works by negative, right? Negative suction. So it has to be deflated. So in other words, if you go in to see a patient who has a hemovac or a Jackson Pratt, and the Jackson Pratt is fully inflated and the hemovac is fully inflated, then you know it's not working. Okay? That's not the way it should be. The hemovac needs to be pushed flat. Jackson Pratt needs to be squeezed so that there's an indentation, because that's how it works. So tell him there will be a hemovac and explain that to him. Why does he have a hemovac? To drain any additional fluids that might be there, because why? You don't want it going into his lungs. Okay, and that's just a preventive measure. You can praise the doctors for that. Okay. We talked about a different form of communication and the speech therapist. If by any chance this person, anyone with a trach, has a need for CPR, you are not going to do CPR mouth to mouth, are you? It's called mouth to stoma. Yes. Oh, I see faces here. Mouth to stoma. Okay. We talked about suctioning, the need for frequent suctioning. What is your job as a nurse? Well, your job as a nurse, when you are doing any kind of suction, whether it's NT suctioning or ET suctioning or trach suctioning, whatever kind of suctioning you're doing, your job is this. Okay, you've got to assess the secretions and you've got to assess the respiratory status. So basically, you need to auscultate lungs before you suction. Okay, before you suction. Hyperoxygenate before you suction. Suction. Okay, hyperoxygenate, and listen again. All right? That is you're only going to do one pass, of course. If you're going to do more than one pass, remember it's a sterile technique. You wait till you've completed all your suctioning attempts, and then you auscultate after. But that's the methodology. All right? You're listening to the lungs first. You want to know, you want to get your baseline. You want to know, okay, what does it sound like? Pretty junky? All right. I need to suction him. Okay, then you hyperoxygenate him, because remember what happens when you suction. You're pulling the oxygen out as well. Okay, so then you suction him. All right? And then you hyperoxygenate after suctioning. Okay, so it's very important. And you also need to document. You need to document, what do the secretions look like? Were they tenacious? In other words, were they thick? Okay, were they liquid? What color were they? Were they white, yellow, brown? What color were the secretions? Okay, was there an odor to it? Or was there not an odor to it? Okay, what was his respiratory status? In other words, he needed suctioning. Why? Because he was huffing and puffing at 28 breaths a minute, 32 breaths a minute, and after suctioning, he calmed down. So what was his respiratory status before and after?
Please move to the next section of